We are going to begin this information session at this time. So, Christy, if you would please begin the recorder. Thank you. Good afternoon. I'm Nancy Lee, the COVID-19 Systems Coordinator. This is the information session for the COVID-19 Community Coordinator, CCC's, Vaccination Events and Comprehensive Health Recovery Initiative. Today is for Track 1. This RFP is being issued by the Minnesota Department of Health, MDH, the Center for Health Equity. We will record this Track 1 vaccination events section and caption it and place it on the web page for the RFP. I will refer to the request for RFP, the request for proposal as RFP, and the COVID-19 community coordinators as CCCs. Place any questions in the chat and my colleagues will advise me at the end of the presentation so that the questions can be answered. And I would like everyone to please mute their line so that we have as few interruptions as possible. The current COVID community coordinators will be called CCC for the remainder of this discussion. Assisting me today will be Dai Vu, the CCC lead supervisor, to offer her insights. The RFP, also Renika Evans, will monitor the chat and at the end advise me of questions. Carly Lavallo is helping also with questions and technical matters, and Christy Wynn is providing technical assistance today. First, we would like to acknowledge that the land we live upon is the ancestral lands of the Dakota people. So let us just take a moment to recognize this fact. Today, this information session will cover the following information. First, the COVID Community Coordinator legacy, so to speak, which this new CCC RFP will build upon. We'll review the goal and objectives of this proposal. We'll look at the proposed details and then consider the application process and instructions. And finally, questions will be answered at the end of this session. I am showing right now, and so I just want to say one other thing. I encourage you to place all your questions in the chat, and I will finish the presentation and then my colleague will present each question. So we'll do our best to answer questions today, but these will be preliminary answers. The official answers will be posted on the FAQ page so that we can be sure to get all the necessary details included. Shown here are the MDH staff who are contract managers and will likely be assisting the newly funded CCC contractors. As you can see, we have a variety of people who provide guidance, mentoring, and support for the CCC contractors to help assure that their work plan goals are met. CCC contractors are community-based organizations that connect Minnesota's diverse communities to COVID testing, vaccination, and other resources. This is the legacy that this program will live upon. We believe it's essential to draw on community strengths and trusted community networks to respond effectively to COVID-19 and to longstanding health inequities made worse by the pandemic. So CCC's contract with the state to serve communities hit hardest by COVID-19, particularly communities of color, American Indian, LGBTQ, and Minnesotans with disabilities. And so for each of those communities, we have a CCC lead who helps support them. Also, the CCC support Minnesotans who need COVID-19 information specific to their communities in their own languages. And so the coordinators help the community members find and get critical resources to deal with health concerns, as well as employment, food access, housing, rental, childcare, and legal rights. And they also help find out where the COVID-19 vaccines are available and how and where to get vaccinated, as well as healthcare and mental health resources. So this RFP will follow that legacy with two different parts that you have read about and brought you here today. One is called Track 1, Vaccination Events, and Track 2, Comprehensive Health Recovery. So let's take a look at all the elements of the request for proposal. So the goal is to build upon the state's efforts to contain the COVID-19 pandemic, increase the vaccination rates, and enhance the health of all Minnesotans by focusing on equity in the communities that have experienced the greatest disparities. This funding supports two different tracks: vaccination event planning and hosting with emphasis on community engagement, or community-based programs that address long-term comprehensive health recovery and builds flexible, equitable health programs contributing to sustainable systems that will better withstand future shocks. Or you might decide upon Track 3, which would be a combination of both of these. And you will note on our forms, it will clearly ask you whether you're choosing Track 1, Track 2, or both. The CCCs will help advance health equity by creating community program resources needed to address these systemic needs that are not adequately met by existing resources. And the recovery approach should be holistic, recognizing people's complex identities and engaging with family, neighborhood, and community. First, for eligibility, this is a competitive process, but all existing MDH contractors are eligible, but there is no precondition for any particular one receiving this award. MDH is not purposely carrying over any specific community organizations from this year without review. The process is open to local not-for-profits, tribal nations, faith-based organizations, human and social service organizations, healthcare organizations, for-profit businesses, transportation agencies, trade associations, and others. So the state welcomes partnerships and collaborations on proposals. Organizations that collaborate on proposals are encouraged to compensate partners appropriately for their contributions and to assure equity in deciding how resources are distributed among partner organizations. And if an organization or an applicant is not federally recognized, you may come in with a fiscal agent to assist you. That means the fiscal agent is an organization that assumes full legal and contractual responsibility for the fiscal management and award conditions of the grant and has authority to sign the grant agreement. So Applicants must clearly demonstrate in your literature that you serve one or more of the communities most disproportionately impacted, and that you are serving and led and staffed by 51% by communities most disproportionately impacted. This is a priority for us, and when you see the submission form, it will ask a question in regards to this. CCCs are, we look for them to be based locally or have staff living in the area where they plan to serve, that they have a record of community engagement and leadership that's rooted in health equity and racial equity here in Minnesota, and that you'll be leveraging trauma-informed holistic approaches to well-being and looking at the intersection of identities. So that might be the intersection of Latinx with disabilities, or American Indians who are LGBTQ. So if you have the opportunity to provide programs that highlight this intersection, please be sure to explain that clearly in your proposal. Applicants may focus on a particular locality, a region of Minnesota, via virtual engagement or travel within the state of Minnesota to support populations they are serving. So that will be something we'll look for as well. These are the communities most disproportionately impacted. These are the ones that we are focused on: African American, African immigrant, American Indian, Asian American, Pacific Islander, Latinx, LGBTQ plus, persons with disabilities. And also on your submission application, we ask, are there some other demographics that you are intersecting with these primary groups? That might be persons who are incarcerated or low income, older adults, migrant workers, new immigrant or refugee persons, youth, unsheltered or homeless persons. But this list is not all inclusive, so you're not limited to just the above. So think about who else might you be able to serve that is most disproportionately impacted by this COVID pandemic, and they too need to have your assistance and support for recovery. Today, we're focusing on track 1. And so I'd like you to do something for me, and my colleague Carly will be looking for this. Raise your hand. Use the reaction button to raise your hand to let me know how many of you here are not only interested in track 1, but you're also interested in track 2. So that will be tomorrow. So if people would raise their hand and keep it raised for about 15 seconds, Carly can take a little count here. And while she's counting, I'll just keep on for a little bit. Tomorrow we'll go more into depth for track 2, which will be a complement to this. And of course, you're welcome to join. So we'll be looking at track 1 and track 2 tomorrow as well. And tomorrow's is February 8th, 2:00 p.m. So slightly different time tomorrow. So as you can see here, the items that are listed are those that we expect for track 1. In particular, to host at least 2+ events per month and spend 50% plus of your funding on those events. Coordinating with local public health, medical providers, and others in order for these vaccination events to be successful. Your planning needs to incorporate the Social Vulnerability Index. We have a link to that in the RFP so that you can read that carefully. And it includes registration for vaccination appointments. And if appropriate, you might have a public hotline that can help answer questions. You'll be providing COVID-19 health education, cultural and linguistic vaccine health education. So we want to be sure that you're sharing information in a language that is familiar and most comfortable to your communities. You'll publicize and mobilize community events, and you'll have effective communication methods and networks. In a little while, we'll have more information about these vaccination events, but I just wanted to give you an overview of the deliverables as they are listed in the RFP. If your organization is selected by MDH, we will work with you to finalize a work plan that incorporates all of these things. Now, this is a 2-year funding range. So the idea is that for 2 years, you would be looking at the lower end of the range, $100,000, and the upper end, no more than $500,000. Not every organization will ask for the full amount, and that's fine. MDH realizes that some organizations may wish to request less than the $100,000. In other words, less than $50,000 a year. And that's absolutely fine. You're just asked to include a rationale for how your proposed program can be effective at a range less than $50,000. So the range allows for MDH to imagine supporting at least 30 or more organizations. And as you can see, again, for track 1, I want to emphasize that you're spending at least 50% of the funds on vaccination events. And the application is due on February 28th, no later than 11:59 p.m. And if you have your hand up, you can take it down now. Thank you so much for helping us with that little survey. So you might be asking yourself, okay, what will this be like applying for this track 1 vaccination events? So I'm going to ask my colleague, Dai Vu, to open her mic and spend a little time talking with you or sharing some hints from that arena. And you have at least 5 minutes, Dai.
Thank you, Miss Nancy. Good afternoon, everyone. I'm very happy to see everyone here and to show your interest in being a part of this COVID community coordinator work. Miss Nancy asked that I share a bit about what event planning entails. And like Miss Nancy mentioned, we really are trying to get partners who will help us reach our most disproportionately people who have been impacted by this COVID. And so in order to be an efficient, have an efficient event, it's important to identify partners that you may already working with. It could be community partners, it could be faith partners, it could be just businesses that you may know that have access to the people who may need vaccines in the future. And so to identify your locations, really to have a team. So that means if you are a smaller organization, you might want to reach out to other partners to create a team, a collaboration to do this work. But if you are able to, you can apply for some additional dollars to hire on for increased capacity. And then after that initial planning is to host. And so in order to host, you really need to have all the pieces together, which is location, logistics, vaccine providers, whatnot, and our CCC leads can actually help you with some of that. As a potential organization to host, you need to make sure that you could help with registration. Community engagement is a huge part of this work. We rely on our CCCs to know where the people are, what the communities need, and how to really reach them. And so help with registration for the vaccine, but also really while they're there to help with other pieces of COVID that they may need as well. And then often right now we do have people that might need additional shots upon their first one. So really being able to recall them for their future shots or reminder shots if there's possible, because considering this is a 2-year contract. Once that is complete, is report back to MDH how the work is doing, to really share stories and pictures. The picture here was from our Cultural Wellness Center, one of our current CCCs. As you can see, all the elements of what an event might look like. You need tables and chairs and tents and spots. So that's something that we can actually help with, or you yourself may be able to be creative in order to procure signage, etc. But the staffing and the planning will be solely on our CCCs. But of course, our CCC leads are there to also assist in any way possible. That's all I have, Miss Nancy. Thank you.
Thank you, Daivu, for sharing some background on that part of the vaccination events. And I want to emphasize that our CCC leads are really instrumental in supporting the contractors with this effort. It really, when they talk about teamwork, this is really what happens here. So if you're not familiar or haven't done vaccination events before for your community, that's okay. We have people who will walk you through the process. If you don't have relationships with medical providers at this time, that's okay. We know exactly who to connect you with based upon the needs of your particular community. So we just want to encourage you that you will be supported in every way possible. So now let's look at the submission form and what is that process like? The submission form is the first thing that you'll be using when you look at the RFP. So the submission form is the first step in your process. It's laying out the background of your organization, and it'll be sharing your vision for your proposal. This section allows you to indicate the composition of your organization internally. As I mentioned before, we ask information about which community that's disproportionately impacted are you connected with. So you'll click one of these. And also, you'll tell us how your organization interacts with the communities in terms of sharing power. So that's going to be something that you should think about and be sure to explain that fully here. Also, you'll note that these questions, we want to understand your primary audience or audiences for whom you intentionally design your organization's services. So this part of the submission form will ask about the primary community. It's one that typically you would have in your mission statement. It would be prominently displayed on your website. So we ask if don't check anyone that just reaches small numbers of communities beyond your target audience, but they are not your primary audience. So be sure not to check anything that isn't primary to you. And likewise for question number 6, where you indicate some other relevant demographics. Again, who is the target population that you intentionally reach through this proposal? So please be sure to take that into consideration. In this section for estimating the community reach, you may choose track 1 or 2 or both. So today we're just looking at track 1. The template has two different sections for you to estimate the annual reach to the specific community. So you will look at track one, you'll see that there's track one, year one for the vaccination events. We're looking for annual numbers of unduplicated persons. Likewise, track one, year two vaccination, the annual number of unduplicated. The template already has some formulas embedded into the document, so please don't overwrite those cells where the totals will show. But you'll enter the name of the activity and the number of unduplicated persons, and there should be an automatic summing of those numbers. Then, in estimating the budget request, again, you choose track one or track two or both. The template has two different sections for you to estimate these. And again, you're looking at an annual funding amount. So for track one, year one, you would put in for your vaccination events how much you expect to spend. It might be slightly less because you're trying to get up to speed the first 3 months, and then slightly more on year two, because now you have all of the pieces in place and you believe you'll know exactly what you're doing. So the numbers that you enter here and on the previous should be fairly close to what you will enter into your final budget. Again, the template already has a formula embedded into the document, so please do not overwrite the cells where the totals will be. So once the organization's background information and estimated community reach and estimated budget are completed, then you're ready for the last two steps. So you'll note the affirmation statement that indicates you read and will implement the state's vaccination and testing policy for your staff. So please read that carefully. There are some requirements there for vaccination and testing. Because you are going out and meeting the public face-to-face in these vaccination events, it's very important to all of us that you and your staff are safe. So these guidelines have been set for that person. Then it tells you about clicking the submit button. So familiarize yourself with the next steps for receiving the email that should come to you, and then click the submit button. The confirmation email that you receive that you've submitted this proposal form, this is not the full proposal submission. You have to now follow the email steps to download the work plan and the budget and return them all by 11:59 p.m. on February 28th. If you don't receive the confirmation email within 1 hour, be sure to check your junk or spam folder. It does happen sometimes. And if not there, complete your supplemental materials, that is your work plan and budget, and mail anyway. And then let us know that, indicate in your email that you submitted the online form but did not receive an email back. So we'll work with you to make sure that your submission form, this form we've just finished looking at, gets done. So our next preview will be the documents related to the second part of the application process. You've submitted the first part, the proposal, with your background information. Now it's time to complete the 2-year work plan and the 2-year budget. So here you can download this 2-year project work plan from the RFP page. We strongly recommend applicants to use this work plan template. Note where you will choose either track 1 or track 2 or track 3, which just means both. The community and demographics are numbered because your work plan will need to reference these numbers. Number 1, African American, or number 15, youth, later on, and we'll show you where in an example. And if the responder uses a different format or template, we prefer a word format, and the work plan must include all the information that's on the template. So it's really to your advantage just to use the work plan as we have set it out for you. And as you can see, once you complete everything, once you've determined and gathered all of your numbers, this work plan should have your final budget request and your total unduplicated number of persons that you'll serve. Now, here is a track 1 example. Now, so refer back to the deliverables and the appendices in the RFP description, and be certain to explain how your proposal addresses either the social vulnerability index or a social determinant of health. So right now we have an example here for you. So let's say your activity might be, let's see, oh, I've got the wrong example for you, I'm sorry. This example is for track 2. Let me go one more. Okay. Oh, okay, I have the wrong example here for you, but what I'm going to say is that for the vaccine track 1 example, you might have an example, and this is shown in your RFP, that will focus on vaccine justice. And in that, you will be looking at how you can connect with persons who are incarcerated. And so what you will be doing is working to create a specific partnership, shall we say, with perhaps the county jail or some other institution. And in doing so, you will come up with an idea of how you can go into that county jail and do vaccination event education, and you can also be able to do vaccinations. So during, say, for instance, the first 6 months, and this example is shown in your RFP, you'll create a collaboration with the county jail to lead bi-monthly discussions with up to 10 incarcerated persons about vaccine safety. And then you'll host vaccination events twice a month for, let's say, 18 months. Since you spent the first 6 months creating your collaboration, making sure that everything will be safe as you go into the facilities and that you are properly vetted, whomever your staff is. So you will then have key staff. You'll have 2 social justice outreach staff and 1 correctional officer. And then your estimated number that you will reach over that first year, which would be 6 months, times 2 events, times 10 people, would equal 120 unduplicated persons. And then for the year 2, you're up and running. You have your 12 months. You still have to do at least 2 per month. Maybe you do more. Then you have 10 incarcerated people, and then that would be 240 unduplicated persons. And as you can see in the numbers, into the number from above for the community of focus, number 10 would be the community for persons who are incarcerated. So that example is clearly shown in the RFP. So look for that example as a way to help you figure out what you are going to do for the vaccination. Attachments. So right now we're going to look at the 2-year budget. And so this is a sample budget, just a sample of some of the information that's on that budget template that you'll download from the RFP webpage. There are 2 sections. You can choose to complete track 1, shown here in blue, and I have a few of the items there. Track 2, shown here in green, will be down below, and that track 2. Or you might fill out both if you are going to go for a combined. Again, we strongly encourage you to use this budget template. It's an Excel document. There are already embedded formulas, and if you do anything different, the budget has to be broken down exactly as it's shown here. So please do try to use what is already provided for you. Please note that indirect costs are not allowed. All admin costs must be specific to this project and allocated according to the project's full-time equivalency or a similar method. So if you only have someone working 50% time on this project, then you cannot charge more than 50% of different elements that might relate to them. For the vaccine-related expenses, we really want to encourage you to carefully consider how much personal protection equipment you need. Again, we want everyone to be safe as you do this work, so be certain to include PPE costs. And the track 2 will have the same set of information will be needed if you're doing track 2. So you'll follow the same protocol for that. Here, there are a section of the RFP that references attachments. Be sure to review that for other documentation relevant to the contract. A link to the sample contract template can be found in there, and you'll want to look through that, especially if you're new to working with the state, and see what information may be requested of you, particularly around insurance requirements and how to procure certain items, requirements which may apply in the event of a response results in a contract with the state. So we want you to be prepared. To the extent possible, our review committee members will represent the communities that we've previously defined. They'll read through each application, taking into account the criteria that you see here. The history, experience, and qualifications of the organization. That will be 0 to 10 points based on the information that's written into the work plan. Community engagement ideas and the work plan, 0 to 30 points. The alignment with the state's needs, 0 to 20 points. The budget, the cost elements, another 0 to 20 points. And equity, diversity, and inclusion. So these are all the elements that will be looked at, and will be, looking for how realistic are the activities, the number and size of community that you're proposing you will be able to reach out to, and of course your use of the social vulnerability index and things of that nature. So responders will be selected based off their ability to engage communities with culturally relevant and linguistically appropriate and timely activities that increase the community's understanding of and engagement around COVID-19 vaccines. So again, the email you receive will, after you have complete the submission form and click submit, the email you receive will have clear directions how to download the needed materials. You'll complete the work plan and the budget and save them with your organization's name. Then you'll return to the email that has your submission data, and you'll attach the work plan and budget. And you'll send it to the email that's listed here on or before 11:59 p.m., February 28th, 2022. Please also remember that respondents received after the deadline will not be considered, even if errors or delays were caused by issues outside of the responder's control. So start writing your proposal early and send it as early as possible. During the months of March through April, applications will be assigned to the review team and carefully read. So after the competitive review of these proposals, selected contractors we look at them representing a wide range of geographic area here in Minnesota, serving the communities most disproportionately impacted, and prioritizing entities that are led by those communities. Sometime in May, we anticipate sending out notifications to those selected and begin notifications. And as we've said before, the contracts will begin July 1 and in June 20th, 2024. So one thing to remember about the proposal deadline, after the deadline, if MDH concludes it lacks proposals that reaching one of its priority communities, the submission process may be reopened and submissions will be received on a rolling basis until we find someone to support those communities. In the meantime, after you apply, please do not contact the state to inquire about the status of the response. Please do not contact any other staff members. If you have questions, use our email address that is within the RFP to ask questions. These are resources that could help inform your proposal. The RFP has links, hyperlinks to each one of these items. The COVID community coordinators, as we said, the legacy group, you'll see who they are and what they've been engaged in. The social determinants of health may be helpful to you. Background on equity goals and the social vulnerability index, and the Centers for Disease Control and Prevention post-COVID conditions. So if you still have questions after this discussion, feel free to send them to our email address listed here, health.covidoutreach@state.mn.us. We need all of those questions by February 18th, and we'll put in about 2 days from then, we'll place the final answers there. Your full proposal application due on the 28th. Although we will attempt to answer questions today, the official answer will be placed on the webpage to assure that we do not miss any details and so that everyone who is interested has the same set of information. Since we have a second information session for track 2 tomorrow, February 8th, the answer for both of these tracks will be uploaded at the latest on Friday, February 11th. So we encourage you to allocate yourself enough time this month to complete the full proposal application. And as we've said before, what that means is taking the email you receive with the original submission material, adding to it the work plan and the budget, and sending all of that together by the due date. So, just can we please stay on mute, please?
Izarwa, dame.
And now is the time for questions, and please stay on mute. Please note that the answers given during this information session are preliminary. Once we review the questions more carefully, the official answers will be found on the FAQ page, and the link is being placed in the chat at this time for that FAQ page, but it's also listed in the RFP. So, Ms. Renika, would you start me out with the first question, please? And Carly, would you please keep track of our time so that we end on time at 2 o'clock? We may not be able to address all questions, but we'll do our best. Ms. Renika?
Thank you, Ms. Nancy. The first question is a funding question. Is $500,000 also the max amount for the organizations applying for both tracks?
Correct. 500,000 is the maximum amount, regardless of track 1, track 2, or both tracks. And realize the assessment of your proposal will be looking at, how well will the funds be spent in terms of amount of time, number of unduplicated persons reached, and the whole of the proposal. Yes.
The next question is a vaccination question, vaccine events. There's 3 parts. The first part, do organizations who are applying for both track 1 and track 2 have advantages in the selection process than those who are applying for only one track?
No, not at all. Nope.
Can we focus on track 1 and engage in providing focus resources from track 2, even if it's not a comprehensive health recovery plan?
Track 1, our goal is that I'm going to use the word that your expertise is really focused on enhancing the vaccination rates here in Minnesota. That your ability to help pierce the hesitancy that may be in your community of focus. So if you're looking at vaccination events, we really want you to focus there. And maybe you partner with others who are doing the elements of comprehensive health, which is more like, I'm going to say potential like programs or workshops or things of that nature. Now, that doesn't mean that in the vaccination events arena, you are looking at health. Yes, you are knowledgeable or have to be knowledgeable about issues related to the vaccination and what the effects are. So, but we really want you to focus more in that arena. And Miss Dye, is there anything you would say? Have I gone in the right direction?
You are on point. Thank you, Ms. Nancy.
Okay, next question.
Yes, the other part of that question would be, if selected, do we have the hotline resources as we have it now?
So if you are interested in a hotline resource, and we encourage either track to think about that, that would be part of your budgeting. So, and we need to know that because depending on how many organizations are looking at a hotline, will determine whether or not we would go with what's called our current vendor, or whether it would just be part of your existing system. So that's how that would work.
The next one is a funding question. Can you explain a little bit about the $500,000 funding?
I would need more clarity about So I'll ask that person to open their mic and just quickly explain your question. What's the name of the person who asked that question?
Is it Owa? Owa?
Spell their name.
I think that is Mr. Awol from Brian Coyle.
Okay, we'll go to the next question. It's not.
Okay, the next question is a vaccine event question. Are the CCCs responsible for finding vaccine providers, or is MDH going to assist with providing vaccine providers?
Definitely medical staff, your CCC leads have connections with those medical providers, and you will be assisted in partnering you with an appropriate clinic or health provider. Yep. Go ahead.
Thank you. The next question is regarding the forms of documents. It says question number 2 doesn't have a space to say if we have Latinx in our organizations, or where can we respond to that if our board or staff is more than 51% Latinx.
I think if your board or staff is 51% of any one of those communities most disproportionately impacted, and Latinx is one of those, then you will just check that box.
It sounds like, Ms. Nancy, they're saying it doesn't have, there isn't a space. Question number 2, it says, doesn't have a space to say if we have Latinx or Latino in our organization.
Okay, we will look more closely at the RFP submission form and try to determine what it is that might be problematic. So we'll certainly look at that. Thank you for letting us know.
Okay. The next question is the event question. What is a responsible planning phase to find vaccine providers and start the vaccination events?
I will ask Ms. Daihu to answer that.
Thank you, Ms. Nancy. I did put into the chat that it takes at least 2 weeks to secure a medical provider. For agencies that have not hosted before, I would just give plenty of time and really to plan, make sure that your staff are properly trained. Like Ms. Nancy mentioned, there's some issues where, you know, in terms of how to do community outreach, the registration process, but also just making sure that your staff are comfortable if they haven't, for instance, if they haven't been out and about doing outreach, to make them feel safe as well, but make sure that they properly have the PPEs that they need. About 3 to 4 weeks is how I would say plan for something, but at least 2 weeks for us to find a medical provider for you if you cannot find one on your own. So 3 to 4 weeks will be a good amount of time.
Next.
Yes. The next question: Does it have disadvantages if 2 organizations who serve 2 different cities, counties, partners? If you have a contract for testing with MDH, you would still glasses. You would still able to apply this funding as well. Is this correct?
Okay, I'm trying to look at it in the chat here. Does it have a disadvantage if 2 organizations who serve 2 different cities, counties partner? if you have a contract for testing with MDH, you would still be able to apply. I want to answer the first question, the second question. If you have a contract with MDH in some other arena, you are welcome to apply. So it doesn't matter what contract you have, you are eligible. Is there a disadvantage if two who serve two different partners? I don't see a disadvantage in that. The question is it advantageous to you? So I don't see that as a disadvantage necessarily.
The next question, how Track 1 is different from the current vaccine program that we are already doing?
I'll ask Di, is there anything in particular that you would state about this question?
Thank you, Ms. Nancy. To your answer, Sheikh Youssef, that the Track 1 is very similar to what our new CCC RFP will look like. I can imagine that there might be some requests to go to pockets of community that may have lower vaccination rates. We're doing a great job in the metro and in some other areas, but there are really true pockets of, even within the metro in Greater Minnesota, where we could use your help as an agency to reach. So the locations might be a little bit different, and not knowing what the vaccination requirement will be in the fall for the next 2 years. It might look a little bit different in terms of the messaging. So right now, a lot of our CCCs that are doing vaccines only are mostly hosting, but as you can recall, a part of this new contract for Track 1 is community engagement. So as the vaccines change, how would community engagement change, and how would RCCC's activities change? So I can imagine that might be just a little bit more creative on the side of that, but it should not be very different in terms of the Track 1 and what we're currently doing now in terms of hosting.
Okay, we're at 1:57, and Ms. Renika, we have time for one more question, and the rest of the questions will have to go to the chat, but I would like to take this last question. I see something here that says, there are many of our community members dealing with autistic children, which causes huge stress for the parents. Can we include in our proposal ways to help those who are affected? So if you're saying that those children and families have been affected by COVID-19, the pandemic, and you can certainly either apply on the vaccination side if there's a concern about how do we effectively vaccinate those children without causing trauma, or you might be on the comprehensive recovery track. So yes, eligible, you decide which track is best to be in. So I am going to need to end this today. Questions that we did not get to will be answered in the FAQ. A quick answer to, are there requirements for workers' comp? That's where we ask that you look at the contract, the PT contract. It will tell you what the requirements will be, because it might have some specific dollar amounts if that were the case. And again, if you don't have everything that's required as a entity, recognized entity, 501c3 or EIN, you can also have a fiscal agent to support you. Thank you so much, everyone, for being here today. It's wonderful, your interest in this proposal. Tomorrow we meet again for Track 2 and actually Track 3. So it will go through the full proposal with Track 1 and 2, but we will focus more clearly on Track 2 as elements of concern. I'd also like to say, for the person who asked about question number 2 on the submission form, Is your organization led by people of color, American Indians, individuals with disabilities, and/or LGBTQ? The terminology people of color encompasses African Americans, Latinx, Asian Americans, Pacific Islander. So as you can imagine, that's an umbrella term. So I hope that provides clarity for that. Thank you, everyone. Here's our email. Please email any further questions to health.covidoutreach@state.mn.us. That way you'll get the official answer to any question you have on our FAQ. Have a great day. Take good care. Bye now.